Hi, everyone. Let's go ahead and discuss chapter 23. Okay, just kind of following along in the chapter, the first slide is an introduction, growing recognition of the benefits afforded to society by the promotion of health and prevention of disease, disability, and premature death is something that we're going to go ahead and talk about. And kind of something that this is alluding to is we tend to focus on what we call curative medicine, and curative medicine is what we tend to practice in this country, trying to cure diseases, which appears to produce actually a negative return on health improvement. And curative medicine increases healthcare costs. Um, like I said, our focus has been curing diseases, not as much as focusing on promotion of health, which tends to have better outcomes. We're going to also discuss influence of anthroculture factors, which are beliefs and values that are just kind of ingrained in American culture, which has had a big influence on our healthcare system. And that's why it's remained predominantly private as opposed to a national tax finance healthcare promotion or program. The next is we're going to study the 10-year Healthy People initiatives. And this is an important part of the next two sections. And these initiatives were undertaken by the U.S. Department of Health and Human Services to illustrate steps in the direction of promoting health and preventing disease, promotion and prevention, instead of a curative medicine, wait till somebody gets a disease and try to cure it. Equity in the distribution of healthcare services. Um, we'll discuss that as well. I'm just kind of going to approach that in a couple different ways, and we'll talk about that. So, significance for manager and policymakers. Health of a population determines healthcare utilization. So, planning health services must be governed by health trends and the demographics of that area. So, the health of the population is going to determine what type of healthcare we're using. They need to design appropriate educational, preventative, and therapeutic initiatives directed to this population that is in their area of these policymakers. Evaluating the effectiveness of healthcare organizations. You want the programs implemented that have the greatest benefit to their community, to this population that's being affected by this area. And measures of health status and utilization for evaluating the adequacy and effectiveness of existing programs. Make sure that the existing programs are adequate and effective. For planning new strategies, measuring progress of these programs, and discontinuing any services they may be ineffective for the population in that area. And these are the significance of what managers and policymakers are to do. So the next part of this chapter, they talk about the basic concepts of health. And health is the medical model defines health as the absence of illness or disease. So this implies that optimal health exists when a person is symptom-free or they don't have any symptoms. Sociologists define health as the state of optimal capacity. So when we talk about the World Health Organization, they actually define health as more than just the absence of disease. It's a state of complete physical, mental, and social well-being, not merely just the absence of symptoms or the absence of disease. And we're also going to talk about holistic view coming up. So when we talk about holistic health, we're talking about 4 components. And holistic health has raised interest, especially in the past decade, which emphasizes health and well-being in every aspect of what makes a person whole. So holistic medicine seeks to treat an individual as a whole person. It includes the physical dimension, so physical health, mental dimension, mental health, and the social dimension as well. The fourth one here is spiritual, and just a couple things interesting on this. So in addition to physical, mental, and social aspects that are necessary for optimal health, this spiritual dimension is incorporated as the fourth element in this holistic health. And there's just a growing volume of medical literature, both in the United States and abroad, that points to the healing effects of a person's religion and spirituality on morbidity and mortality. The importance of spirituality as an aspect of healthcare is also reflected in a number of policy documents by the World Health Organization as well as other bodies. So just some things I'm going to kind of take from your textbook on page 637 and just take me a minute. Based on their extensive review of the literature, this group concluded that religious practice spirituality is associated with reductions in death from all causes, as well as reductions in deaths from cardiovascular disease. Patients with heart disease who attend regular religious services have also been found to have a significant survival advantage. Spirituality has been shown to have a positive impact on a person's quality of life, their well-being, and their mental health. And the chapter continues on with more specific examples as how research and studies have shown that the spiritual dimension has contributed to healing effects for a person. So next, we talk about basic concepts of health, and we talk about quality of life. And this is the overall life satisfaction during and following in a patient's healthcare delivery system encounter, their visit to the hospital, etc. And it's twofold. One, an indicator of how satisfied a person is with their healthcare experience. You can put here like a patient satisfaction would give us an indication of how satisfied a person was. And you see this in hospitals and doctors' offices and every facet of healthcare. And the second fold, overall satisfaction with life and self-perceptions of health after a medical intervention. So what is their satisfaction after a surgery, after they've had an MI, after they've been in the ICU on a vent or a trach, those types of things. So that is the two kind of main parts when we talk about quality of life. Risk factors of diseases. Okay, risk factors increase the likelihood of developing a particular disease or health condition. And this epidemiology triangle gives us kind of an example of what we have when we talk about risk factors for disease. Obviously, the agent, like a pathogen, the host, a person, and then the environment plays a role in diseases. Okay, so that's kind of important to think about all three of these. And for example, we think about somebody who gets tuberculosis. We have a person, and we have the tubercular bacilli that actually causes tuberculosis. But those don't single-handedly predict that a patient is going to get tuberculosis. So for example, just because I'm exposed maybe to the agent or the pathogen of the tuberculin bacilli doesn't necessarily mean I'm going to get TB. There's another component to that right here as far as predictability of who's going to get a disease. And in this example that I'm giving you, tuberculosis. What are some other factors that are included that are environmental? Poverty, people who live in overcrowded living conditions, somebody who's malnourished. These environmental situations also have to be in play for somebody to get this disease. Yeah, okay, so that's enough of that. Okay, next, behavioral risk factors. So there's certain behaviors and lifestyle choices that represent important risk factors for illnesses and disease. Example, Smoking has been identified as the leading cause of preventable diseases and death in the United States because we know it increases the risk of heart disease. We know smoking increases the risk of stroke. It increases the risk of lung cancer. It increases the risk of COPD. Okay, so that's something that we know. And this table right here from your book, table 23.1, indicates the percentage of the US population with these behavioral risks. Alcohol, 12 years and older, 51% of the population um, um, are included when we talk about these behavioral risk factors are included in 51.7% of the population. You don't need to memorize these numbers. Just kind of understand this part over here. Marijuana, 12 years and older, percentage of the population, 9.6%. Illicit drug use, 12th grade and older, 14.8%. 10th grade and older, 6.3%. 8th graders, 10th graders, 6.3%, and 8th graders, 2%. Cigarette smoke, 12 years and older, 17.9%. Hypertension, overweight, and obesity, 70.9%, and hypercholesteremia, 11%. So these are behavioral risk factors that contribute to diseases. So also, we want to talk about durations when we talk about diseases, and acute is acute, subacute, and chronic conditions. Okay, so acute, short duration, it's treatable. An example here is a myocardial infarction, an acute MI, a kidney stone. Subacute is a condition that requires continuous treatment even after a discharge from the hospital. Somebody who had maybe somebody who had an accident and they had some head trauma and they're trached and on a vent right now. They can have to go to a subacute unit, or they have subacute duration. It's going to be longer than something that's acute. And then, of course, chronic, one that persists over time. Chronic conditions, what we call progressive. Chronic conditions don't get better, they get worse. There isn't a cure for them. They're not reversible. We can treat them medically, and examples of chronic conditions that we see in our country quite a bit: hypertension, arthritis, diabetes, depression, asthma. Those would all be considered chronic conditions. Asthma, it's still considered a chronic condition, but the definition is a little bit better as a sense that it doesn't like continually get worse and progress. It's more of a reversible disease, but it certainly is considered a chronic condition. 3 reasons for the rise of chronic conditions. 1, new diagnostic methods. Okay, so we can figure it out sooner. Medical procedures. Do medical procedures, for example, somebody gets some stents in their coronary arteries, and so that gives them longevity, and they're living now 10, 15 years longer. And that's why we see such an increase in heart failure, because now these people are living long enough for their heart to failure. So certainly medical procedures would contribute to it. Any medications, pharmaceuticals that can be the reason we keep somebody longer, getting a statin. So as they get older and older and older, they develop chronic condition, maybe some hypertension, diabetes. Screening and diagnosis, the same concept. And of course, lifestyle choices. Lifestyle choices, we talked about smoking, food. The foods that we eat have a very high correlation with chronic diseases. Number 1 being coronary artery disease, and the foods that we eat have a high correlation. Cancer and the foods that we eat. About 50% of cancers are believed to come from things that we ingest in our body, and about 33% of cancer deaths are believed to be related to food. We know that COPD is related to a lifestyle choice of smoking. Stroke, somebody who has stroke, very high correlation with lifestyle choices, particularly their diet through a lifetime. Okay, I'm going to go ahead and stop here, and then we'll continue with part 2.